Today, people are so busy that it's hard for them to take care of themselves, and this often threatens our health. Sometimes, we even become frustrated at unexpected results. However, there are many qualified professionals constantly working for the healthy recovery of those suffering patients. To serve the people and contribute to the welfare of humanity, the Korean Society for Laboratory Medicine is always by your side. The term clinical laboratory test may not be familiar to many, but actually it's closely related to our health. We go to the hospital when we get sick. We have specimens such as blood or urine taken and tested to find the right diagnosis and treatment. These are called clinical laboratory tests. Besides blood or urine, numerous other specimens such as stool, cerebrospinal fluid, and acidic fluid can be used for testing. These specimens are moved to different areas of the lab depending on the purpose and methods of testing. Clinical pathologists provide test results and interpretations based on the latest medical science to enable medical staffs to choose the best treatment for their patients. The fields of laboratory medicine include diagnostic hematology, clinical chemistry, diagnostic immunology, clinical microbiology, transfusion medicine, and diagnostic genetics. Diagnostic hematology involves tests on many different blood disorders. Clinical pathologists provide the necessary information to doctors and patients through test results on hemoglobin levels, white blood cell and platelet counts, and coagulation function. When automated devices provide limited information, experienced clinical pathologists can reveal the cause of the disease using a microscope. Various tests are also conducted on the bone marrow, which is an important hematopoietic organ, to diagnose diseases including blood-related cancers like leukemia. Clinical chemistry is a field of analyzing a wide variety of components such as electrolytes, kidney and liver function metabolites, lipids, and drugs using serum or plasma from collected blood. To ensure accurate results, test equipment are checked beforehand if they are operating properly, and test results are regularly verified to make sure they are correctly reported. Testing of the patient's sample in this way helps the medical staff to provide the most appropriate treatment. In addition, clinical pathologists directly interpret special chemistry tests such as therapeutic drug monitoring, protein electrophoresis, and neonatal screening, and manage to ensure that point-of-care tests such as arterial blood gas analysis are performed correctly. When bacteria or viruses enter the human body and its antigens are exposed to us, our immune system produces antibodies against it. Based on the interactions of these antigens and antibodies, the field of diagnostic immunology performs tests on AIDS, viral hepatitis, infectious diseases, allergies, autoimmune diseases, and tumor markers. Also, HLA typing and cross-matching tests are performed and interpreted to find suitable donors for hematopoietic stem cell transplantation or organ transplantation. Clinical microbiology is a field that identifies microorganisms such as bacteria and viruses in the patient to determine the cause of infectious diseases and plays an important role in infection control in hospitals. All specimens from the human body, whether blood, urine, stool, or sputum, are subject to testing. After culturing the specimens, the microorganisms are examined by visual observation, staining, and biochemical and molecular characterization for identification. Furthermore, tests to identify pathogens that are highly contagious, infectious, and lethal, such as tuberculosis, are also performed to reveal the cause of disease. When antibiotic treatments are required for patients, this field assists in the proper selection of drugs through antibiotic susceptibility tests. Patients who need blood transfusion may face lethal consequences if they do not receive transfusion properly. Thus, the storage of blood components, selection of compatible blood, and precise issuing are all conducted under the most stringent control and management by clinical pathologists. Tests performed in the field of transfusion medicine are basic and yet very important as they are directly related to the safety of the patient. Transfusion medicine also directly contributes to the treatment of various diseases such as hematologic, metabolic, and neurological disorders, as well as organ transplantation through apheresis and blood components therapy. When hematopoietic stem cell or organ transplantation is required from donors with different blood types, blood transfusion is safely conducted by selection of blood components by clinical pathologists. Diagnostic genetics is a field that enables appropriate treatment of patients by performing the detection, analysis, and verification of the genes and genomes of humans or pathogens. Diagnostic genetics is largely classified into cytogenetics, which analyzes chromosomes, and molecular genetics, which analyzes genes and genomes. By applying the rapidly developing molecular genetic technology to clinical practice, we utilize this for the diagnosis of various hereditary diseases and also prenatal and tumor diagnosis. In doing so, clinical pathologists have an extremely important role by accurately reading test results and genetic counseling.
우리 진단검사학과 전문은 검사가 성공적으로 달성될 수 있도록 진단약 검사실을 운영하고 관리할 뿐만 아니라 진단검사와 관련된 업무를 총체적이고 전문적으로 수행함으로써 환자와 의사에게 신뢰할 수 있는 검사 결과를 제공하는 전문 의료인입니다.
In order to provide fast and accurate test results, more than 1,000 clinical pathologists are working at hospitals, referral laboratory centers, and blood centers across the country. With reliable test results, accurate test information, development of new technologies, a global leading role in laboratory medicine, and public service and communication, our society will continue to contribute to the progress of medicine and the improvement of public health.